Starting.
Hello,
Hello,
I'm
doctor.
I'm a new doctor. I'm Doctor. May I have your name?
My name is Mr. Smith.
Okay. Uh, Thank you for coming to see me. How can I help you today, Mrs. Smith?
Well, doctor, I have this urine infection, and it happens so often. I've done another test now, and I think it's probably urine infection again, and I'm
Mm.
really fed up with it. I don't know what I should do.
I'm sorry to hear that. I understand your concern. Okay. Let me ask you some other question. Okay, to have
Okay.
more better idea what's going on. So. How many time have you got this urinary infection in your
I
life?
Well, I don't know. I think it's
Some more.
4 or 5 times probably. I'm not
Okay.
counting anymore.
What kind of symptoms do you have?
Oh, like the burning sensation, and that's feeling that you have to go to toilet all the time, and then you have to run to the toilet, and
Mm-hmm.
I have to get up at night 5 or 6 times. Yeah, it's all that.
Mm-hmm. Do you have any fever or something?
No, no, I haven't had that.
Okay.
No.
Okay. Uh, do you feel full even after urination?
No, not really. It's
Mm-hmm. Good.
but yeah, I have to go too often, really, and sometimes,
Mm-hmm.
yeah, sometimes I feel like I need to go again after I have finished.
Mm-hmm. Do you have any belly pain? Any kind of?
No, I don't have any pain.
Okay, good. And okay, good. Thank you for sharing this information with me. Okay, you have a lab data or something? A urine test? You did a urine test?
Yeah, it was a culture. Yes,
Uh-huh.
they said you have received the results, so that's why
Okay.
I'm here today.
Yeah, yeah, I saw your test, and this shows me you have, yeah, kind of urinary infection. And uh, Let me ask you about your diet. How about your diet? Do you have a healthy diet?
Yes, doctor. I eat lots of vegetables, fibers. Um, I drink
Mm-hmm.
2 glasses of
Great.
water, 2 cups of
Mm-hmm.
coffee, and I walk about half an hour every day. So I
Mm-hmm.
have a very healthy lifestyle.
Very good. I'm glad to hear that.
Thank you.
It seems you take care, very good care of yourself. Uh, okay, good. And okay, okay. And okay now. So I believe you have infection, okay, and for treatment you need to take some antibiotic, okay, and beside that you have to consider hygiene. Uh,
I'm careful with my hygiene, doctor. It's
mhm.
just, I don't know why this infection keeps coming back. Is there anything we could do to stop this UTI coming back again?
Yeah, I also don't know exactly what the cause of this recurrence infection, and I have to do some other tests, and maybe I need to do imaging study for your prostate as your age. Because of the prostate gland would be could be more growth and with age, okay, and this is a very very common situation in the elderly. I mean, this age.
But I'm young at heart, doctor.
Yeah,
So
yeah.
yeah.
You look very young. But I don't mean. I'm not. I'm sorry. So, let me reassure you, this is treatable with this antibiotic, and to make sure, I need to do other further assessment like imaging I mentioned, like ultrasound and other examination I need to do to make sure what's exactly going on, what's wrong with you.
Okay. And so, I mean, what can I do for now to
Okay.
prevent this?
Yeah, you have a great lifestyle and good for you. Please continue it. And beside this, you need to take antibiotic. I'll prescribe it. And then you need to do other test, urine test again after finish the antibiotic, and then get back to me to see the result, and then we can discuss more about it.
So, apart from the test, is there anything I could do now?
So okay. I can, if whenever I uh, reach the definite diagnosis, I can help you much more to resolve the current UTI to you will not experience the other infection in the rest of your life.
Okay.
And okay, and let me ask you some other question. Okay, um, uh, you better off to when you you know uh, after urination, you have to make sure your bladder is totally empty, and you if you feel full after urination, you better off waiting for a minute to make sure there's nothing not or there is nothing any urine in your bladder. Okay.
Okay. Okay.
And do you have any question for me?
No, that's it, doctor. Thank you.
Nice to see.
Uh, okay. No, we just ran over 3 minutes. Okay. I just wanted to see what you're doing, and uh, okay. So it is a gentleman with UTI, recurrent UTIs. Okay. So 88-year-old man with recurrent UTIs. Okay. Now, what's your feeling about this case? How did you
Mm,
do? Are you happy or
awful.
or, or
Because
uh, what score would you give yourself out of 10?
hmm, 5.
5 out of 10. Okay. So what went well? I mean, the parts that you did well, I mean, we were looking at the structure, rapport, info gathering, um, identifying and exploring eyes, and info giving. Okay. Uh, so which parts of which part did you do well? I mean, because you said you get five and you lose five. The ones that you did well, which ones are they?
Mm, information gathering, I think it was not bad.
Good. So information gathering was good.
Hmm. And um, so I didn't convince the patient very well. I didn't answer his concern for recurrence infection and
Uh,
what he need to do
okay.
for
Uh,
prevent of recurrence.
Okay, we're looking at what you did well. Okay. So, I mean,
Okay.
was your rapport good?
Uh, mm, that's
Hmm?
mm,
Yeah.
good. Yeah.
Okay. How about your structure?
And structure. It was mm, disorganized.
Hmm. Good. Okay, it was disorganized, so it wasn't structured. And so, did you feel that you were confused, or you actually did things in a different order, or
Yeah, I cause mm, I couldn't look at the task very well, and I just.
okay? No, we're not saying why at the moment.
Mm-hmm.
So we're describing. So what I would like you to tell me is what happened and what we could do differently next time you're doing this consultation.
Mm-hmm.
So, in terms of a structure, what do we mean by a structure? What could you do?
First, I have to. Mm,
Patient comes in, you ask, you greet the
yeah.
patient, rapport, ask questions, gather information to identify and explore eyes. And when you explored eyes, then you make a decision, you start giving information related to the
Mm-hmm.
eyes. Okay. So now in this structure, what did you do differently? I mean, which part you didn't do?
Mm. Uh, information giving. I
Hmm.
think it was. Mm, what do you think? I don't know.
Okay, that's why you're getting confused
Yeah.
because you
I got
still
nervous actually.
yeah because you don't know what you're doing. Okay, we need to know at each part of the consultation what we're doing, and we need to manage it. Okay, the interlocutor wouldn't manage your consultation; they just respond to you. Basically, mm, uh, what is the single most important thing we are going to do in this consultation? In any consultation, the patient comes to you, you do something, and the patient goes. What makes you both happy?
And when I think the patient, I answer very well to patient's concern,
Okay,
and I solve his problem.
okay, good. So, uh, in order to do that, what is the single most important thing you need to do to find out?
Just pay attention to patient.
Mhm. Well,
Uh,
if as you said if I solve the patient's
mhm.
concern, huh? So
Yeah,
to solve it, you need to find it. Okay.
yeah. First, I need to find.
Okay, so you need to find it and then find what exactly it is. Okay, so
Mm-hmm.
it means to find it and examine it. Okay,
Mm-hmm.
good.
Because I just had the test result, and he had UTI,
Hmm.
but I didn't know what's the cause of this UTI, and I said, okay, I need to do some other test and exam.
So, but what was the scenario? In the scenario, does it say that you need to do more tests?
No.
No. Okay, so that's what I'm saying. If you don't do that, if you don't follow the scenario, they think that your comprehension is not good,
Oh.
and then you will. So you need to follow that what is guided in the
Mhm.
scenario. You cannot say anything you like.
Okay.
Okay.
Because I asked you, can I mention to prostate? You said when whatever you think.
Yeah, but I think it is relevant. But well, I will play it with you again,
Mm-hmm.
and you can see what I'm saying. Okay, so basically, uh, right. So what could be done differently? I think the structure, because you asked some questions and then you said, I think it is UTI. You actually said your blood shows UTI, and then you started to ask about my diet and my
Yeah.
lifestyle, and then after that you said it is UTI, and then you asked some questions again. Okay.
Yeah.
So you ask questions, give me the diagnosis, ask questions again, gave me another diagnosis, the same thing, and then ask another series of questions. Okay, so the structure wasn't actually what we were expecting to be. So the best thing is actually to ask all your questions. Even if you forget some things, just leave it. Don't ask questions again. Okay,
Mm-hmm. Okay.
unless it is something new
Yeah,
which
I
comes up.
missed the first task, and then.
Then okay. So basically, if you miss it, don't come back. Don't go back because you will lose the mark for the structure. You lose
Mm-hmm.
40 marks.
Mm-hmm.
So the next that is the first. The next thing you need to do is to find the ice. The patient is telling you, Doctor, I'm fed up with this. What can I do to stop it? Okay,
Mm-hmm.
and you're telling him, okay, I need to do some tests. You see, I'm asking something else. You're giving me something else. Okay. It's like you go to a shop and you say, okay, could I have a bottle of shampoo, please? And they give you a soap. So I said shampoo, and they give you the soap. Shampoo, soap. Okay. Right. And information giving. Did you actually ask me what I think, or did you ask me? Did you chunk at all?
Okay, no.
No. Okay. You kept going, right?
Mm-hmm.
Okay.